Welcome back. For your health, is social media the cause of depression in teens? News 4 Tucson's Sean Mooney has the latest findings.
A recent study suggests social media may not be causing depression in younger people. Canadian researchers surveyed nearly 2,000 preteens, teens, and college students over several years about their social media use. Researchers found it did not lead to depression symptoms later on. Experts believe those who are feeling depressed may be using social media as a way to make themselves feel better. Also, a new study shows calls to poison control centers for eye exposures are quite common. There were nearly 1.5 million calls to poison centers between 2000 and 2016 for eye exposures. Most occurred at home or the workplace and involved cleaning products, cosmetics, or pesticides. While half of the patients were adults, younger kids were a close second due to exposures to household items. Experts say parents should make sure their cleaning products are in child-proof containers and keep them stored in a locked cabinet. And lastly, doctors want to remind you about the importance of taking care of your skin during these cold winter months. Your skin tends to become dehydrated in the winter due to lack of humidity, leading to damage on unprotected skin. And your hands are vulnerable to cracks and cuts that may put you at risk for an infection. Doctors urge you to wear proper clothing, such as gloves, and use moisturizer. For the latest health news, go to KVOA.com/foryourhealth. Sean Mooney, News 4 Tucson.
Well, teens who smoke marijuana may be at an increased risk for depression. Researchers from Canada and England studied data from 11 international studies involving more than 23,000 people. Those who smoked pot during their adolescence had a higher risk of depression, suicidal thoughts, or attempts as young adults. There was no similar link when it comes to anxiety. Do you know there's a right way to shower? Well, according to one dermatologist in Texas, there are 4 things you need to be doing in the shower to lower your risk of infection, itching, acne, and dry skin. Haley Hernandez reports.
You don't want to take super hot showers because according to Dr. Sherry Ingraham from Advanced Dermatology, it can dry your skin and that can be worsened by the type of soap you use. She says look for gentle cleansers like Aveeno, CeraVe. Never use bar soaps.
Older classic bar soaps that are fragrance that you've seen advertised for years, those really strip the skin barrier. And what I say to patients is soap is really basic. The skin wants to be at an acidic pH. So if you over scrub and you over soap, you're making your skin more basic, and it takes hours for it to go back to its normal pH that maintains the best skin barrier.
Another way you may be stripping the skin is with a loofah or washcloth, which Ingraham says to stop using immediately.
You are designed to be self-cleaning. You don't have to scrub your skin, buff your skin, loofah your skin to get yourself clean. And when we scrub off those lipids that we were literally evolutionarily designed to have, we're scrubbing away our protective barrier against the environment and making ourselves more prone to infection, which is what you're trying to prevent in the first place.